Hey Kelly, I'm Simon Wade. I'm a student with the physical therapy department, and I just wanted to check in with you today, talk with you a bit, and see how you're doing.
Okay.
How you feeling today?
I'm just in a lot of pain right now.
Yeah, I bet. I mean, you've been through a lot and
Yeah.
a bunch of injuries and a lot you're overcoming right now.
Yeah.
So, speaking of pain, that's actually something I wanted to talk about today.
Okay.
And I wanted to say that, first of all, that you've been through a lot, and people that have gone through what you've gone through have also been through a lot of pain.
Mm-hmm.
So what you're feeling isn't unusual, okay?
Yeah.
And what happens after an injury like that is the way you feel pain is it can affect our nervous system and the way our body reacts to pain.
Yeah.
Because the first time we feel pain, it's an important message we want to know about.
Mm-hmm.
It's our body saying, hey, I need to stop something or change something to get away from that pain, right? For safety.
Mm-hmm.
But our nervous system that carries that message from the part of our body all the way to our spinal cord to the brain, it can stay sensitive for a little bit after that and be ready for more messages, right? It's like on alert. It's the sensitivity's turned up.
Yeah.
And so in a case like you've been through with, your shoulder and your leg and your spine and your ribs, you had a lot that really is turning your system up. Your system's very prepared to try to protect itself right now, if that makes sense, right? And so what's important to think about here is if we get really anxious and fearful of not wanting to move, it can actually, that anxiety and that fear can even turn that sensitivity up more. And if we don't move, we don't allow our body to do the things it needs to heal, right?
Okay.
Movement helps bring nourishment to the injury site and take away debris and stuff. It's a very important part of getting blood there and blood out of there, right?
Okay.
But the good news is we can work with this. And so we can learn what level of pain is okay and what level of pain means maybe we do need to be alarmed.
Yeah.
Because right now I'm sure it's really alarming for you, right?
Yeah.
Yeah.
Definitely.
Exactly. So when you move and you have a mild amount of pain, and it's like a 1 or a 2 or a 3 out of 10 in pain, that doesn't necessarily mean that you're hurting your shoulder or that you're injuring your spine more.
Mm-hmm.
It's, to some degree, it can just be your nervous system that's already really turned up and your nerves and your spinal cord are ready to send that signal.
Yeah.
So it doesn't necessarily mean we need to stop moving.
Okay.
But if we start to get up into 5s, 6s, or even 7s out of 10 in pain, once we get up to about that 7, maybe it means we need to reduce what we're doing a little bit,
Yeah,
okay?
I got you. Okay.
But the important thing is we don't need to be super worried about discomfort or mild pain, okay? Because again, to summarize, it's like an alarm, right? And the sensitivity is turned up where instead of a window breaking sets off the alarm, something very simple like a leaf or a small branch falling in the yard can now set off the alarm, okay? So we just need to remember what we can do and start to get confident and comfortable with moving, because that's going to help decrease that sensitivity too, okay?
Okay.
Sound good?
Yeah.
Okay.